Arriving MLAB appointments. This e-learning will demonstrate the process for arriving patients for MLAB appointments by the patient access representative within the MART Pavilion. By the conclusion of this e-learning, you'll be able to arrive a patient for their appointment from a work list. There are several patient access stations at the Cancer Center in the MART. Patient access stations located on the 5th floor include physician visits, hospital clinic visits, and the laboratory. Patient access stations located on the 6th floor include the infusion center and pediatrics. In general, in the MART, patient access representatives are responsible for pre-registration, registration, financial screening, patient arrival, patient check-in, and power orders activation except for infusion. PM Office opens with the Conversation section. Select Work List to navigate to the Today's Expected Arrivals work list. Select the Today's Expected Arrivals work list. Double-click the Today's Expected Arrivals work list. The Today's Expected Arrivals work list now appears. Locate the patient and their appointment. All of the appointments will be arrived. However, only the first physician appointment and the lab appointment will be checked in through EWS, which will be provided in an additional education. Take note, pre-reg displays as yes, cleared displays as yes, and copay displays as yes. This indicates that the patient has been pre-registered, is financially cleared, and the copay has already been collected prior to their arrival to the appointment. Select the first appointment for the desired patient. Take note that it is a lab visit. Lab visits generally occur prior to the provider visit. Right-click on the patient. Select Register Patient. This will open the encounter with which we complete the registration and arrive the patient. Note: the patients will be notified by the patient access representative when the laboratory does not take the same insurance as Stony Brook University Hospital. Scripting will be provided in a supplemental education. The blue arrow indicates that there are missing mandatory fields. Conversely, when it is dithered out, also known as grayed out, all of the mandatory fields have been completed. Always obtain and/or verify any alternate names for the patient. Always obtain and/or verify the patient's maiden name when applicable. Always obtain and/or verify the patient's mother's maiden name. Always obtain and/or verify all of the other fields within the banner section. Don't forget to view the copay deposit required field and the financial clearance fields, as the information in these fields may differ from encounter to encounter, regardless if the encounters are for the same patient. Always view the NPP receipt and NPP date fields, as the Notice of Privacy Practices is given once in a lifetime for every patient for regulatory agencies. Lastly, always view the e-signatures obtained and the date e-sig last obtained fields, as consents need to be obtained for every patient for regulatory agencies. Click the Images button. This will allow the patient access representative the ability to view a scanned picture ID and insurance cards. Always ensure we have the most current images. The consents are also obtained through the Images button. The document image window opens. Any dates located under the patient's name are the dates labeling when the documents were scanned and/or imported. Click the plus sign in the document tree window to view any documents scanned and/or imported on 6/1/2017. The driver's license and insurance cards are scanned into the system. Always view the scanned images to ensure we have the most current copies scanned. Take note: the driver's license and insurance cards will remain on the medical record level, which means these items can be viewed within any of the patient's encounters. Select Driver's License to view the driver's license. Compare the scanned driver's license with the patient's current driver's license. Select Insurance Card. Always remember to compare the scanned insurance card with the patient's current insurance card. Select Insurance Card Secondary. Remember to compare the scanned insurance card with the patient's current insurance card. Click the Close button to close this window. The Patient Positively Identified field must be completed with every encounter. The criteria for patient positive identification: 1. The patient must provide a government-issued photo identification card. And 2. The patient must be able to state who they are or have a surrogate state who the patient is. Click the drop-down. Select Yes. This field now reflects that the patient has been positively identified. Next, we will scroll down within the Patient Information tab to verify the patient's primary care physician. Remember to always verify the patient's primary care physician along with their address to ensure the correct primary care physician is documented. Selecting the wrong PCP is a patient safety issue. Click the Binoculars button to verify the physician's address when the PCP documented is correct. This will allow you to document a different PCP when needed. The physician documented appears in the Provider Selection window. When selecting a different physician, click the Clear button and enter the partial last name and the partial first name of the physician, then click the Search button. The physician's position must display as P4 or Referral Provider. In situations where it displays as Must Update or External Provider, an email must be sent to patientaccessqa@stonybrookmedicine.edu, as the physician's information needs to be updated within Cerner. Now we will click the Preview button to view the physician's address. Scroll down to view the physician's address. Be sure to confirm the physician's address with the patient. If it is not the correct address, click the Close button and begin a new search for the correct physician. Now that we have identified that the correct PCP has been selected, click the Close button. Now we will click the OK button. Enter T in the PCP Verified Date field to have today's date populate in the field. Note, today's date now appears. Enter N in the PCP Verified Time field to have the current time populate in the field. Take note, the current time now appears. All of the fields are now updated. Click the Encounter tab to enter the patient type. Click the drop-down in the Patient Type field. Now we will select Outpatient. The patient type now displays as outpatient, and the consent related to this encounter will now display in the Sign eForms window within the Images button. When there is a General Consent and Agreements Hospital Ambulatory Services consent within the past 365 days, we do not need to obtain a new consent. It is best practice to use the View Encounter conversation to search for the consent through every previous encounter related to ambulatory services. We should never have the patient sign another consent if we already have one on file within the last 365 days. For this example, the patient will require a consent to be obtained as there is not a consent on file for this patient. Click the Images button to obtain the General Consent and Agreements Hospital Ambulatory Services English. Note, this consent is also available in Spanish. Select the Sign eForms icon. The General Consent and Agreements Hospital Ambulatory Services English consent now appears. For Spanish-speaking patients, click the Select Forms button to obtain the General Consent and Agreements for Hospital Ambulatory Services in Spanish. All of the consents now appear. Click the box next to General Consent and Agreements, Hospital, Ambulatory Services, Spanish. Click the OK button to have the consent appear in the Sign eForms window. The Spanish version of the consent now appears within the Sign eForms window. For this example, the patient does not require a Spanish consent. To proceed, select the General Consent and Agreements, Hospital, Ambulatory Services, English Consent. Click the Present button. This window will appear upon launching the consent. This section is used to document any special services the patient will require. This section is used to document when a verbal consent is being obtained. Click in the box to indicate that the patient is aware and agrees to the terms of this portion of the consent. Scroll down. Again, let's scroll down. Click in the box to indicate that the patient is aware and agrees to the terms of this portion of the consent. Click in the box to indicate that the patient is aware and agrees to the terms of this portion of the consent. Let's scroll down. Click in the box to indicate that the patient is aware and agrees to the terms of this portion of the consent. Again, we will scroll down. Click in the box to indicate the patient is aware of the process for billing any patients with Medicare. This section is for Medicare patients only. Here, we will scroll down. Again, let's scroll down. Click in the box to indicate that the patient is aware and agrees to the terms of this portion of the consent. Let's scroll down. Again, we will scroll down. Click in the box to indicate that the patient is aware and agrees to the terms of this portion of the consent. Here, we will scroll down. The patient now signs the signature pad. Click the Accept button. The current date and time now populates. The Enter Signee Relationship dialog box appears and the option of Self auto-populates. When the signee is not the patient, select the correct relationship within the drop-down. Click the OK button. The relationship now populates. The witness name populates with the name of the patient access representative. The patient access representative now signs the signature pad. We will now click the Accept button. The current date and time now populates. Let's scroll down. The patient access representative signs a signature pad under Documentation of Interpreter or Special Assistance section. Now we will click the Accept button. The current date and time now populates. Again, click the Accept button. The Enter Requested Information dialog box will appear. Do not enter any information in this box unless you are obtaining a verbal consent. In this example, a verbal consent is not being obtained. To proceed, click OK. To proceed, click Accept. Again, the Enter Requested Information dialog box will appear. Do not enter any information in this box unless you're obtaining a verbal consent. For this example, we are not obtaining a verbal consent. To proceed, click OK. The green circle with the white check mark indicates the consent has been successfully obtained. Click the Close button to close this window. The consent now appears in the document tree. Take note, every consent obtained, with the exception of the no-fault consent, will remain on the encounter level, which means the consent, excluding no fault, can only be viewed in the encounter in which it was obtained. Click the Close button. The e-signatures obtained field must be updated to yes, and the date e-sig obtained field must be updated to today's date. Click the drop-down within the e-signatures obtained field. Select Yes. Enter T for today's date to populate within the Date e-sig obtained field. The fields now reflect that the consent was obtained for today's date. The arrow is now dithered out, meaning it's gray, so all of the mandatory fields have been completed. Next, we will select the Insurance Summary tab to view the comments documented by the previous patient access representative. Scroll down to view the previous comments section. Always view the previous comments section. To view other comments that may have been documented prior to what is currently displayed in the previous comments section, click the ellipsis button. All of the notes previously documented within this encounter appear within this window. To close this window, click the OK button. Always remember to document your notes within the New Insurance Comments field. After documenting your notes in the New Insurance Comments field, click the Complete button. This is the Refresh button. Upon completion of the patient registration, clicking the Refresh button within the Today's Expected Arrivals work list will remove the encounter from the list. Click the Refresh button. The encounter is now removed from the work list. The next encounter scheduled for the same patient will now need to be arrived from the list. You have now completed the Arriving MLAB Appointments e-learning. Thank you from the Patient Access Department. See you at the next lesson.